Namaste and welcome back to Ayurveda Unplugged. I am Srushti and I'm happy to be back for episode 3. In our last episode, we discussed about Travancore Ayurveda and its unique treatments, Ushtaprasadana and Matru Raksha. Today, we're going to talk about patient expectations, refunds, and the path to trust in holistic healing. To guide us today, we have once again Ayurvedic expert Dr. Smita Kattigotur. Welcome back, Dr. Smita.
Thank you so much, Srushti. I am glad to be here once again and share my thoughts on such an important topic.
Let's dive right in. Doctor, we've heard a lot about patients having expectations of refunds if their Ayurvedic treatments don't meet their expectations. Could you shed some light on this?
Absolutely, Srushti. This is something many Ayurvedic practitioners encounter. While Ayurveda offers holistic and personalized treatment, the nature of healing is gradually and differs person to person. Unlike allopathic treatments that might provide immediate relief, Ayurveda focuses on root cause healing, which takes time. However, some patients expect rapid results and equate this with guarantee of success.
That's an interesting point. But why do you think patients feel more comfortable demanding refunds from Ayurveda compared to allopathy?
I believe it comes down to perception. Modern medicines has established itself as default healthcare system and its processes are well accepted, even if treatments don't always work as intended. In contrast, Ayurveda is sometimes seen as an alternative practice yet. So patients may feel they are taking risk, leading to heightened expectations and demands for guarantees. It's a mindset issue, Srushti. I feel this reflects the need for better awareness.
That makes sense. But from a legal perspective, what rights do patients actually have and how should practitioners handle them?
Legally, Ayurvedic practitioners are governed by the same medical ethics as any other healthcare provider. Transparency in communication, clear consent forms, and setting realistic expectations from the beginning are essential. It's crucial to explain that while Ayurveda aims to restore balance and health, results may vary. Documentations, informed consents are key to avoid misunderstandings.
So, would you recommend practitioners to provide any kind of written disclaimers or policy of sorts?
Yes, I highly recommend it. A written policy that outlines the treatment plan, esteemed time for recovery, and potential outcomes helps set the right tone. It's important to communicate that Ayurveda is a process, not a quick fix. This way, patients are more likely to trust the process and stay committed.
That's great advice. How can we involve the government or the regulatory bodies to support Ayurvedic practitioners in such cases?
I think advocacy plays a big role here. The more practitioners come together to voice these concerns, the more likely regulatory bodies will address them. Highlighting success stories, sharing patient journeys, and emphasizing the long-term benefits of Ayurveda can push for greater recognition and protection for practitioners.
Fantastic insights, Dr. Smita. Before we can wrap this up, what would be your message to patients who seek Ayurvedic treatments?
My message would be to trust the process and understand that Ayurveda is about sustainable healing. It's a collaboration between the patient and the practitioner. Healing takes time, and patience is the only key. By supporting Ayurveda, we preserve a valuable tradition that has healed generations. I also want to emphasize that I respect all forms of treatments. We believe in the growing trend of integrative medicine across the world, where diverse systems of healthcare work together to provide the best outcomes for the patients.
Thank you so much for sharing your perspective. In the next episode, we're going to address Travancore Ayurveda's trusted medicines and NABH accreditation. Until then, stay rooted, stay radiant. Namaste.
Sukhino Bhavantu.